Hi everyone, I have a really exciting case to share with you today. As you've already saw in the title, you know what this case is about, but for a second pretend as if you don't know about this case and just to look at this radiograph. So patient presents to you saying that he fell on the sidewalk yesterday and today he started to notice that his jaw was a little sore, specifically left jaw. So if you were the dentist seeing the patient and took this panoramic radiograph, what would you have said to the patient, or what would you have done? So go ahead and compare the right and left condyle and condylar neck, pretty much the entire ramus. And then some of the things that you can do are measure, if not look at the overall length or the height of the ramus. So that includes the condyle and condylar neck all the way down to the angle of the mandible. You can compare that to the left side, and also look at the position of the condyle where it is. So those are pretty those are some of the things that you want to be asking yourself when evaluating condyles and the mandible in general after a trauma. Although we don't have a ruler to measure the precise height of the mandible, something that's relatively obvious is the position of the condyle. In this case, on the right side where the patient is asymptomatic, it appears to be well seated in the glenoid fossa, or just kind of slightly just below and inferior and posterior to the crest or tip of the articular eminence. Whereas if you look to the patient's left side, this condyle appears to be more anteriorly located than the right side. So if this is the tip articular eminence, it appears to be more anteriorly located. And also there's an overlap of the articular eminence and the condyle. What about the border? Nice and smooth and continuous border that we see. Over to the left, here's that border that I can trace and I lose it. And then there's another border that I can trace. So there's something going on that we want to pay close attention to. This border as well, there's that border of the condyle as well as the sigmoid notch. But then overall cortication of this condyle and where it is, how this joins with the sigmoid notch is different from this side. So having said that, now let's take a look at this joint in cone beam CT. So what we have here is the limited field of view scan of the patient's left TMJ joint. As you know, I like to look at the scan typically starting with axial view. So that's what I'll do here as well. So let's go up to the top. For those of you who haven't looked at cone beam very much in the past, I'll put a guideline here. Let's see if that's gonna show up. The blue plane. There you go. So what I'm seeing here is represented by this blue plane. Okay, so hopefully that should be helpful. So let's look at the axial. From here, we're going through zygoma, right, and zygomatic arch and part of the joint, and that's what you're seeing here, right, that zygomatic arch. So now let's move downward. We're seeing part of the coronoid process. Again, if you're not sure, look over to this side. This blue plane is cutting right through the coronoid process. So that's coronoid process, and we're starting to capture condyle. Again, I know many of you haven't looked at cone beam CT, but I just want you to know this is not normal, where there's a abrupt disruption in the cortical outline, right? There's a definite step deformity. And also there's a separation. This will make more sense as we evaluate this in all three different planes as well as the 3D rendering view. I just want you to know that's not normal, and I'll try to make it as clear as possible. So let's go over to the anterior aspect of the scan, and now we're going to scroll through the coronal section. And to do that, I'm going to turn on green plane. So as I move posteriorly, that green plane is moving posteriorly as well. So we're cutting through the patient's left zygoma. So there's that zygoma, and then that's the maxillary sinus. So let's move posteriorly. There's that coronoid process, and it dips down, meaning we're now getting to the sigmoid notch, and that's the zygomatic arch as indicated by 3D rendering view. And let's continue to move posteriorly. There you go, that's, you're seeing part of the condyle and the condylar neck, and this is also part of the condyle as well. So I believe this is fairly definitive diagnosis, even if you haven't seen cone beam CT before. That condyle should be located right here on top of this condylar neck portion. You see that? This is where it broke off. So this fracture involved not only the condylar neck but also the condyle, the head of the condyle, and it has cut the or fractured the anatomy in this kind of oblique fashion. Okay, so that's the broken off piece, and then the remaining condyle and condylar neck. Let's look at that in the sagittal view. So again, sagittal view, I'm going to turn on my red plane or the sagittal plane, and let's move toward the TMJ in the lateral direction. Right here, you can already see that the condyle is out of the normal glenoid fossa. It has been displaced anteriorly. There's that broken piece, and there's a remaining mandible. The remainder of the ramus. So now let's look at this in the 3D rendering view. Again, in summary, this condyle has been displaced anteriorly as well as medially. So that's the glenoid fossa. The condyle should be located right here, but it's been displaced medially. So medially as well as anteriorly. Alright, so now let's look at that in the 3D rendering. For the time being, I'm going to hide this red plane and rotate to, again, better appreciate the anatomy. There's that coronoid process and the condyle that's been fractured off. You can see that it's been fractured in this oblique fashion. And let me see if I can remove some of these bones. There you go. So there's that condyle. Let's look at that from this section. I hope you guys are all convinced that it's been fractured and displaced anteriorly and medially, and part of the segment is kind of tucked right over the sigmoid notch or the condylar neck. Okay. All right. That's what I wanted to share with you